and move on. So as I say, we're joined today by Dr. Stephanie Harrison and Dr. Ben Buckley. So welcome, both of you, from Liverpool Centre for Cardiovascular Science. And I'll hand over to you for your presentation on the work that you've undertaken. Thanks.
Thank you, Catherine. If we can just start with the first presentation slide, thank you. So thank you for the introduction. As said, I'm Stephanie Harrison. I'm a Tenure Track Research Fellow at the University of Liverpool Centre for Cardiovascular Science, and I'm going to describe the results of an umbrella review which was commissioned and funded by Public Health England, which examined cardiovascular risk factors, cardiovascular disease, and COVID-19. So I'm not going to start with a large background about COVID-19, as we're all fully aware of the impact the COVID-19 pandemic has had on public health and society. And because of this, there has been a lot of research and interest into what makes some people more susceptible to symptoms with COVID-19 and worse prognosis with COVID-19 compared to others. And from early on in the pandemic, it was hypothesized that there may be links between cardiovascular health and COVID-19 because of prior knowledge around influenza epidemics and other respiratory viruses. So during the pandemic, there's been a rapidly emerging evidence base around pre-existing cardiovascular disease or cardiovascular risk factors, including lifestyle factors such as smoking and other conditions related to cardiovascular disease, and whether that impacts outcomes with COVID-19. And also, some patients hospitalized with COVID-19 have demonstrated a propensity to thrombosis and other cardiovascular complications. And there have been many reviews around these topics, but these have had substantial variability of risk estimates and duplication of patient data, which is why this review was commissioned. So next slide, please. So the two main research questions this review aimed to address were: what is the association between cardiovascular risk factors or cardiovascular disease and health outcomes with COVID-19? And secondly, what is the impact of COVID-19 on cardiovascular health? Next slide, please. Okay, so we conducted an umbrella review, just to give an overview of what that means. So primary studies conduct research to address a particular research question. And a systematic review synthesizes the evidence of different primary studies addressing the same research question. And if there have been multiple systematic reviews around the same topic, an umbrella review can be useful to provide an overview of the evidence from different systematic reviews. So systematic reviews or meta-analyses were included in this umbrella review if they addressed one or both of the research questions, if they met the database of abstracts of reviews of FX or DARE criteria. I'm not going to go through what all the DARE criteria are, but they are criteria for systematic reviews, such as whether the reviews conducted a quality assessment of the primary studies and whether they had a systematic search strategy. So reviews were only included if they met those basic criteria for systematic reviews. And we only included reviews published in English, and we only included reviews focusing on adults. So any reviews examining cardiovascular health and COVID-19 exclusively focusing on children were not included. Next slide, please. So a systematic search was conducted of 14 medical databases and preprint servers. Preprint servers were included because of the rapidly emerging evidence base of COVID-19 research. There has been an increase in the use of preprint servers for this research, researchers wanting to make their results known as quickly as possible whilst the peer review process is ongoing. And because we were searching only over the past year, all results may not have had time to go through that peer review process, so preprint papers were also included. We searched from January 1st, 2020 to the 5th of November. So just to bear that in mind when I'm discussing the results, that was 7 months ago now. So there has likely been more reviews published since then that were not included in this umbrella review. So the figure shows the wide variety of cardiovascular conditions and risk factors that were eligible for inclusion and were included in the search strategy. So pre-existing cardiovascular disease or stroke, along with lifestyle factors such as smoking, and other conditions related to cardiovascular health, such as liver disease, kidney disease, were all factored into this umbrella review. And so next slide, please. So this provides an overview of the reviews were identified after the systematic search was conducted. So after we screened the titles and abstracts and full text that were identified, 84 reviews were identified as meeting the inclusion criteria and addressing one or more of the research questions. The map on the right shows the breadth of countries that were included in the primary studies of the reviews. So earlier on, most of the data published was from China, and more recent reviews were able to include studies from multiple countries. The number of studies included in the reviews range from 3 to 212, but some of the reviews were focused on one particular cardiovascular risk factor or cardiovascular condition, and other reviews examined a range of different cardiovascular risk factors, so those reviews tended to include more studies. And given the nature of the research question, as expected, all of the evidence was from observational studies rather than randomized controlled trials. And earlier on in the literature, most of the evidence was case studies, case series, and then as time progressed, there were more longitudinal, observational, prospective and retrospective studies conducted. Next slide, please. Thank you. So with the 84 reviews, we then assessed the quality of these reviews in the first instance. So we used the AMSTAR2 tool, which is published in the BMJ and includes 16 items that we can use to assess quality of reviews. And from these 16 items, when it is completed, we can then categorize a review as critically low or low quality, moderate quality, or high quality. And 52 of the reviews were assessed as critically low or low quality, likely due to kind of the rapid nature of some of the reviews and wanting to publish results and may not have had the time to do some of the more rigorous steps that we often look for in systematic reviews. But because of the overlapping nature of some of the reviews, there were often many reviews published examining the same risk factor. We decided to focus results on the largest, most recent moderate or high quality review identified. So there were 31 moderate quality reviews identified, and one high quality review, which was examining associations between smoking and outcomes with COVID-19. Next slide, please. So this slide provides an overview of one of the main outcomes of interest, which was severe COVID-19. Just to note that there was variation within the reviews in how severe COVID-19 was defined. There was often multiple criteria, and these varied from including cutoffs for oxygen saturation, whether the patients required mechanical ventilation, ICU stay, and or some of them included mortality. But we just took whatever definition the review used and made sure we reported that within our umbrella review. So we identified moderate or high quality reviews, which examined 8 different exposures related to cardiovascular health and the outcome of severe COVID-19. And we can see that the reviews reported that pre-existing cardiovascular disease, cerebrovascular disease, stroke, high blood pressure, diabetes, renal disease, current smoking and smoking history were all associated with higher odds or risk of severe COVID-19. We can see there were variations in the effect sizes up to a 3.9-fold higher odds of severe COVID-19 with pre-existing cardiovascular disease. And we can also see there was a range in the number of studies included in the reviews. And the moderate quality review, which examined associations between liver disease, and severe COVID-19 did not report a significant effect. Next slide, please. Thank you. So this is the same figure, but looking at the outcome of mortality with COVID-19. So again, pre-existing cardiovascular disease, cerebrovascular disease, high blood pressure, diabetes, kidney disease, and smoking history, all associated with higher odds or risk of mortality with COVID-19. But in this case, current smoking was not significantly associated with mortality, but pre-existing liver disease was. Also, previously, we did not find a moderate or high quality review which examined an association between obesity and severe COVID-19, but we did identify a moderate quality review which examined the association between obesity and mortality. And this review reported a 2.2 higher odds of mortality with COVID-19 for patients with obesity. Again, we can see variations in the number of studies included in the reviews, and also to point out on the right-hand side shows the I-squared statistic, which is a measure of heterogeneity, with higher I-squared statistics meaning higher levels of heterogeneity within the included studies in the reviews. And we can see there is often substantial or considerable heterogeneity. And this was often not well further investigated within the reviews. But it's important to note and highlight when we're considering the results of the different reviews. Next slide, please. So thinking about our second research question was, what is the impact of COVID-19 on cardiovascular health? We did find reviews which examined the prevalence of cardiovascular complications in patients hospitalized with COVID-19. And there was a wide range of cardiovascular complications reported, ranging from 2% experiencing acute heart failure, 4% myocardial infarction, 7% experiencing deep vein thrombosis, 10% myocardial injury, 10% angina, 18% arrhythmias, and 19% pulmonary embolism. We didn't identify any reviews which examined whether there was a potential longer-term impact of COVID-19 on cardiovascular health. And we didn't identify any reviews which examined the impact of cardiovascular health on long COVID. Next slide, please. Okay, so we did a brief discussion about the potential pathways linking cardiovascular health and COVID-19. So we can see from the results of the review that there are many different associations between cardiovascular health or risk factors and worse outcomes with COVID-19. But what are the pathways surrounding this? What might be causing this potential link? So there may be a link between COVID-19 and cardiovascular complications because some patients hospitalized with COVID-19 have shown a hyperinflammatory response, which could lead to the worst prognosis or cardiovascular complications we're seeing with COVID-19. And some cardiovascular risk factors, such as diabetes, can lead to immune function dysregulation and can increase susceptibility to COVID-19 and also worse outcomes with COVID-19. And some other cardiovascular risk factors, such as obesity or smoking, can directly impair pulmonary function, again, potentially leading to this increased susceptibility or worse prognosis reported with COVID-19 in these patients. Next slide, please. So just to point out the kind of strengths and limitations around this review. So the search examined a wide range of cardiovascular risk factors and conditions. We are able to assess many different systematic reviews and focus on results reported in moderate and high quality reviews only. However, there were inconsistencies within the included reviews. As already highlighted, there were variations in definitions for severe COVID-19, often high levels of heterogeneity, and importantly, variations in how reporting of adjustment for confounding factors occurred. And although we did a comprehensive search, we did not identify any moderate or high quality reviews for some of the risk factors of interest, including diet, physical activity, arrhythmias, cholesterol, or dementia. Next slide, please. But overall, this evidence is highlighting links between pre-existing cardiovascular disease or risk factors and worsened COVID-19 prognosis, which is important for identifying high-risk patient groups. And many of the risk factors are potentially modifiable. So where we did not identify reviews for factors such as diet, physical activity, which are potentially modifiable, need for further research in those areas. And it's important for healthcare professionals and patients to know that targeting cardiovascular risk factors may not only improve cardiovascular health, but could potentially improve outcomes for people with COVID-19. And this has implications for large-scale cardiovascular prevention programs such as the NHS Health Check. Next slide, please. So this just shows a snapshot of a blog that was published by Public Health England, which highlights the key messages from this review. And this just shows the key cardiovascular conditions and risk factors associated with severe COVID-19 or mortality, and that's available at the web link shown. Next slide, please. And I'd just like to thank the co-authors, including Dr. Ben Buckley, who's here to help answer any questions after the presentation, and other collaborators in the Liverpool Centre for Cardiovascular Science, and Public Health England for commissioning and funding this review, and Hannah Sullivan, Katherine Thompson and Joanna Wood at Public Health England for their support and feedback throughout the review process. A report of the findings of this review is available on the NHS Health Check website at the address shown, and a journal article was also recently published highlighting the results of this review, available at the European Heart Journal Quality of Care and Clinical Outcomes, again at the link shown. So next slide, please. So just thank you for your time today and listening to this presentation, and me and Dr. Buckley will be happy to answer any questions. Thank you.
Great, thank you, Stephanie. That was a really fantastic overview of the work, and you've made it in a really concise and simple presentation, so thanks so much for that. We're going to stop recording now so that we can take questions.